Okay, so we've got a picture of who gets heart attacks, and people obviously would want to know, well, how do I know if I'm having a
heart attack? Of course.
So maybe you could tell our viewers, what are the signs of a heart attack? Does it vary between men and women? Does it vary based on other factors?
Yes. So first of all, the usual symptom for a patient having a heart attack is chest discomfort. And I don't say chest pain because very often, this was one of the things that was taught to me very early in my career. When you and I talk to people about pain, they think of somebody sticking a needle in them or pouring hot coffee on them. But in fact, the discomfort that you get with a heart attack, it's an internal discomfort. So it often more commonly resembles heartburn or indigestion, and it's often a vague symptom, and people have a hard time describing it because it's not, oh, I just stuck myself with this needle, or oh, I just poured hot coffee on my arm. It's a more amorphous, difficult to describe discomfort, and it usually occurs somewhere near the center of the chest. The textbooks will tell you, oh, it's right here over your breastbone, and then people say, oh, it's like a squeezing sensation and so forth. And many patients have that typical symptom, but many patients have atypical symptoms. It can be on the left side of the chest, the right side. Some people feel it in the neck, in the jaw. Some people just feel it down the arms and the wrist. So any upper, above the waist discomfort, below the jaw and below, so it isn't pains up in this part of the head, but anything from the lower jaw to the belly button can be a heart attack. It turns out women a little more commonly experience this discomfort as indigestion. And that's one of the reasons sometimes in the past, particularly since we've had a lot of campaigns that say, no, this is an equal opportunity killer, women can get it. A lot of times women in the past used to delay. Oh, it's just indigestion. I'll take, some antacid. I'll take some Tums or Maalox. I'll be okay. And in fact, it was actually a heart attack that was occurring. And it's important these days to get to the hospital as early as possible, as you know, Andrew, because we can open up the blocked arteries and sort of stop the heart attack in its tracks. And we'll talk some more about that in a minute. But in any case, the important thing for people to know is that it's usually some sort of chest discomfort, often associated with some shortness of breath, often associated with some sweatiness and a vague sense of great discomfort. The problem, of course, is that either 8 or 10 out of people who have this just discomfort, it's not a heart attack. It's a muscle spasm. It is indigestion and so forth. But there's no way you can tell that when you're at home. So, I mean, of course, if you're 18 years old and you have this, it's not a heart attack. But if you're, 60 years old and you've had some high blood pressure and you've smoked in the past, the place to be if you're having discomfort like that is to come to the emergency room. Get an electrocardiogram, let us decide. If it's benign, hey, you go home. It's a muscle spasm, it's an indigestion. If it's a heart attack, you're coming in so we can do things to stop the heart attack.
Many people hear that the symptoms are different for men and women. Is there something to share that will distinguish that?
Yes. Well, first of all, women can have absolutely typical symptoms. The fist in the chest. By the way, this fist in the chest thing is named for a Jewish physician, Dr. Samuel Levine at the Peter Bent Brigham Hospital in Boston. He was the first person to say this is, and so people will talk about, interestingly enough, I would call it the Levine sign, but they pronounce their name the Levine sign. So this is the Levine sign. He was one of the pioneer cardiologists, took care of Eisenhower when he had his heart attack and so forth. In any case, women can have totally typical symptoms, but women present a little more commonly with what we call atypical symptoms. So indigestion or heartburn, or maybe just discomfort in the arm, in maybe more commonly the left arm. So it is a little more common for women to have atypical symptoms, but many women will have the absolute typical textbook described symptoms that you see in men.